Imagine a world where your deepest fears, chronic pain, and even physical limitations could be overcome with the power of your mind. Now, what if I told you that this world isn't just a fantasy, but a rapidly emerging reality? Virtual reality therapy is revolutionizing mental health treatment, but with great power comes great responsibility. Are we prepared to navigate the ethical minefield that comes with rewiring our brains? Welcome to the Brain Talk Sessions YouTube channel. Your journey to a healthier mind starts here, where we share psychology explained for everyday life. In today's increasingly digital world, mental health and rehabilitation have become global crises, affecting millions worldwide. Enter virtual reality therapy, a groundbreaking solution that is capturing the attention of both medical professionals and patients alike. This innovative approach promises a safe, immersive, and potentially transformative experience for those seeking healing. But as we stand on the brink of this technological revolution in healthcare, we must ask ourselves, who ensures that this powerful tool is used responsibly? Let's start by exploring the incredible promise of VR therapy. One of its most well-established applications is in exposure therapy for anxiety disorders and PTSD. Imagine being able to confront your fears in a controlled, virtual environment, gradually building resilience without the risks associated with real-world exposure. This method has shown remarkable success, with many patients reporting significant reductions in symptoms after just a few sessions. But VR's potential extends far beyond mental health. In the realm of pain management, virtual reality has emerged as a game-changer. Patients undergoing painful medical procedures or living with chronic conditions have found relief by immersing themselves in calming virtual worlds, effectively distracting their brains from pain signals. This non-pharmacological approach offers a promising alternative to traditional pain management techniques. The applications don't stop there. In rehabilitation and physical therapy, VR is helping patients regain mobility and confidence. Stroke survivors, for instance, can practice everyday tasks in a virtual setting, accelerating their recovery process. The immersive nature of VR allows for repetitive, engaging exercises that can be customized to each patient's needs and progress. To truly appreciate the impact of VR therapy, let's consider a few clinical success stories. Take Sarah, a veteran struggling with severe PTSD. Traditional therapies had limited success, but after a series of VR exposure sessions simulating combat scenarios, she reported a dramatic reduction in nightmares and anxiety. Or consider Michael, a chronic pain sufferer who found that regular VR meditation sessions significantly reduced his reliance on pain medication. These stories highlight the very real, very human impact of this technology. However, as we marvel at these advancements, we must also confront the ethical dilemmas that arise with VR therapy. Privacy concerns top the list. The biometric and emotional data collected during VR sessions are incredibly sensitive and personal. How can we ensure this information is protected from misuse or unauthorized access? The potential for abuse is significant, especially in an era where data breaches are all too common. Consent is another critical issue. Given the powerful psychological effects of VR, can patients truly understand and consent to all the potential risks involved? The immersive nature of VR might expose individuals to unexpected emotional or psychological challenges that they were not prepared for. This raises important questions about medical ethics and informed consent in the digital age. We must also consider the risks of addiction and dependency. The escapism offered by VR can be alluring, potentially leading to overuse or avoidance of real-world challenges. For individuals undergoing long-term therapy, there's a fine line between beneficial treatment and unhealthy reliance on virtual environments. Perhaps one of the most profound ethical concerns is the potential for reality distortion. As VR experiences become increasingly realistic, patients may struggle to differentiate between their virtual exposures and real-world experiences. This blurring of lines between reality and simulation raises philosophical questions about the nature of experience and perception. As we delve deeper into the ethical landscape of VR therapy, we encounter the thorny issue of bias and manipulation. Like any technology driven by algorithms, VR therapies are not immune to the biases of their creators. These embedded prejudices could inadvertently influence treatment outcomes, potentially reinforcing societal inequalities or stereotypes. Commercial interests present another ethical minefield. As VR therapy gains traction, there's a risk that profit motives could overshadow patient care. We've seen similar concerns in the pharmaceutical industry, and now we must be vigilant about big tech entering the healthcare space. How do we ensure that the well-being of patients remains the top priority? The potential for manipulation extends beyond therapy sessions. What if VR's ability to alter perceptions and behaviors is co-opted for political, social, or commercial agendas? This risk makes our discussion not just relevant to healthcare, but to society at large. Access and inequality form another crucial ethical dimension. The high cost of VR therapy raises serious questions about healthcare equity. In countries like the United States, where healthcare disparities are already stark, could VR therapy become yet another treatment available only to the privileged few? This issue is particularly acute for rural and low-income populations, who often lack access to specialized mental health services. VR therapy could potentially bridge this gap, but only if it's made accessible and affordable. This global disparity in access forces us to confront a fundamental question: should such potentially life-changing therapies be commodified, or should they be considered a universal right? Given these complex ethical challenges, the role of regulation and oversight becomes paramount. Currently, there's a concerning lack of global standards governing the use of VR in therapy. Unlike traditional medicine, which is subject to rigorous regulatory frameworks, VR therapy operates in a relatively uncharted territory. Addressing this regulatory gap will require collaboration between medical boards, governments, and tech companies. Each of these stakeholders has a crucial role to play in ensuring the responsible development and deployment of VR therapy. Medical professionals must guide the therapeutic applications, governments need to establish protective legislation, and tech companies must prioritize ethical considerations in their design processes. Looking to the future, there's hope that an international ethical framework for VR therapy can be established. This would provide much-needed guidelines for practitioners, protect patients, and ensure that the benefits of this technology are maximized while minimizing potential harms. As we conclude our exploration of ethics in VR therapy, it's clear that we're standing at a crossroads. The revolutionary potential of this technology is undeniable, offering hope to millions suffering from mental and physical ailments. However, without proper ethical guardrails, we risk opening Pandora's box of unintended consequences, potentially leading to harm, exploitation, and increased inequality. The path forward requires a delicate balance between innovation and responsibility. We must nurture the development of VR therapy while simultaneously building robust ethical frameworks to guide its use. Only through this careful approach can we ensure that VR therapy fulfills its promise as a force for healing and not harm. So, I leave you with this thought-provoking question: is virtual reality therapy the miracle cure we've been waiting for, or a dangerous experiment with our minds? Share your thoughts in the comments below, and let's continue this crucial conversation. Remember, the future of mental health treatment may very well depend on how we answer these ethical questions today.